This week, the Delta variant drove another increase in America's COVID caseload. But just a handful of states accounted for most of the hospitalizations. Florida and Texas account for 40%, according to the White House. Currently, about half of Floridians and 45% of Texans are fully vaccinated. Those states are also seeing more kids under 18 hospitalized with COVID-19 than any other state. Florida Governor Ron DeSantis and Texas Governor Greg Abbott have both remained resolute in banning school districts from setting mask mandates. Meanwhile, the Texas Tribune is among the outlets reporting on another threat to children's health: respiratory syncytial virus, or RSV. This highly contagious virus can hospitalize kids 5 years old and younger, especially infants. The influx of new COVID patients in hospitals is overwhelming many healthcare workers again. Dr. Owais Durrani practices emergency medicine in Texas. He says that what he's seeing is just as bad as what he saw last year, if not worse. Dr. Durrani joins us now. Doctor, good evening. Welcome.
Thanks for having me. So
when you say that what you're seeing now is as bad as last year, or if not worse, paint us a picture of that. What are you seeing?
Yeah, I'll give you an example. 2 days ago, in the 7th largest city in the United States, in San Antonio, there was no EMS service for about half an hour. So that means if you're in a car wreck and you called 911, there is going to be no ambulance that showed up. The reason for that is how burdened our hospitals are with COVID-19. So, for example, when I go into one of my shifts, I'll see patients who in there that I admitted a couple of days ago. There's no rooms in the ICUs, and they're kind of stuck down here. Now, in the emergency department, we see a lot of critically ill patients, so I try to take care of those patients to the best of my ability, but we have new critically ill patients coming in, and the patients that were admitted a couple of days ago truly deserve the ICU for that close monitoring. And so that's kind of what we're seeing. One other thing is that I work in some freestanding and critical access hospitals. And the job of these hospitals is to stabilize patients and transfer them to tertiary care centers in large cities like Houston and Austin. And once again, those patients are stuck at those sites without the true close monitoring that they need for the best care that they deserve.
Tell us about this disease, RSV, respiratory syncytial virus, for those who are not aware of what it is. What is it, and how does that affect your fight against COVID where you are?
Absolutely. So it's a viral respiratory illness. It's very common. It's very common in the winter season. So the thing that's kind of surprised us and taken us aback is how many cases we've seen in the late spring and into the summer. The reason for that is last year, because we were all masked and socially distanced, we saw almost no cases. This year, because we've kind of come out of that isolation, we're seeing an increase in cases. Normally, kids under the age of 1 are the ones that get admitted to the hospitals. Because the kids in that 1 to 2 age period never saw that virus last year, they are now getting sick with that virus as well. So that combined age group, a certain percentage of it is going to get respiratory illness. They're going to need oxygen, get admitted to the hospitals. Unfortunately, we have the Delta variant at the same time, which is affecting kids much more than the original strain of COVID-19 was. And so that's why our pediatric hospitals are so full. One other thing I'd like to point out is that last year when we were seeing this surge, kids weren't getting as sick. And so pediatric hospitals were able to admit some of our adult patients and help in that capacity. This year, that's not possible. So it's just another strain on our system.
How overwhelmed are the hospitals that you're working at right now? Are they able to handle some of the caseload, or do you feel like it's just kind of a matter of time before everyone's overwhelmed?
Yeah, so we're doing the best that we can. And as I mentioned, even when those patients are stuck in the emergency department, the nurses, the physicians, the respiratory techs, we do all that we can for those patients. We've been transferring patients out to, in some cases, other states, in some cases, 6-7 hours away from the initial hospital that they present to. So we're making do with what we have. But unfortunately, our governor here in Texas has banned mask mandates at a local level, and that's something that we really need. We know kind of
Can I stop you there for just 1 second? You said that you're transferring some kids to other states. So if I'm a parent and I show up with my kid who is sick with COVID, I might end up having to go to Oklahoma or to another state to just sit by my child's bedside?
Yes, that is the case in some cases. And, sometimes that transport has to be air transport, and there's no room for a parent on that air transport. And so we've had cases where we, sent a a 1-year-old, 1.5-year-old alone on a helicopter with strangers, and their parents have to drive for hours to meet their kid where they're going.
How are you handling all this just as a person in the middle of all this? This has to just be hard emotionally, spiritually, and especially since, as you described it, things are worse now in some ways than they were in 2020. It's just got to be tough to carry day to day.
Yeah, I'll be honest, I'm more frustrated and angry in certain aspects of things than I was last year. Last year we didn't have any answer for the things that we were dealing with, and we were trying to learn along the way. We've learned so much when it comes to masking, when it comes to how effective and useful these vaccines are. But unfortunately, we have, some leaders and some individuals in our society that just refuse to do the right thing. And the fact that a lot of this suffering and a lot of this death can be prevented makes it tough.
Before I let you go, very briefly, what's your word to parents who are concerned about keeping their kids safe? Briefly. Yeah, I would say treat this part of the year like you did last year. So wear masks, wash your hands, get the entire family vaccinated if they're eligible, and, get your friends vaccinated and anyone else who you may interact with on a day-to-day basis that are hesitant. Talk to them. Dr. Owais Durrani, I appreciate you making time to share your story with us. Stay safe.